of some of the developments which are happening and competencies which are required for us to be able to work obviously within this sector. So it is a part and parcel when we look at learning and development. This happens with us during our childhood days. Our parents support us with that. When you are at your place of work, we get to see this being supported by trainings which the employer is going to do, and the whole idea of obviously getting it done, or having trainings, and obviously the development for you to be able to get skills, knowledge, which will allow you to do your work more effectively. Now, this particular topic of when we talk about personal and professional development, there is a slight bit of a differentiation between the two. So when we talk about personal development, in general, we basically refer to something that you maintain, and you essentially review, and then you actually update. So when we look at this particular unit of personal and professional development, it's important for us to understand what do we mean by personal development and what do we mean by professional development. So personal development is going to be something that you review, you maintain, you update, and it is something which you are setting as goals or targets to be able to develop skills, knowledge that you would want you to be able to have those skills and abilities to perform certain roles and responsibilities well. Now, this particular aspect of personal and professional development, in a way, can be said that it is to assess your own skills, your abilities, and consider what your aims and objectives are, and then you set goals to be able to realize them, so that you are able to then execute them at your place of work. Sorry. Now, when we talk about professional development, this is something which is going to be related to when you set the targets that you want to achieve, or the skills that you want to develop. But in this case, you maintain it, you update it, but the review can also be done by your manager. And in this case, the review is done by your manager, your supervisor, or at your place of work. And this is to ensure that you are able to maintain professional credentials which are required for you to be able to perform well in your job role. And when we look at the concept of personal versus professional development, this is an essential difference that we look at between the two, is because professional development is related to the development of your career. Sorry. Now, when we talk about professional development, we are looking at you, say, for example, gaining computer skills, skills on customer service, skills on dealing with patients, understanding the 6 C's of patient care, specifically in the health and social care sector. You might be looking at developing skills on budgeting. When we look at our household course, essentially, sometimes this month, everybody is they're looking forward towards Christmas and, Boxing Day sale and things like that, and the new year. You will be doing some effective budgeting at your end to ensure that you're able to have enough money saved to be able to spend on those activities. So here, some part of the skills that you're trying to use, which is skills on budgeting and, managing cash and things like that, are skills that you have on your personal level. But when you use these skills to carry out some of the responsibilities at your place of work, for example, if you work within accounts, and one of the skills that you need is to maintain cash flows, do budgeting, to ensure that salaries are paid on time, this is expected of your job role. So here, some of the skills that you would need would come in from you studying maybe a degree in accounting and finance, understanding what is cash flow, balance sheets, profit and loss account, and that, if it is facilitated at your place of work by your employer, would be termed as professional development. So personal and professional development tend to be slightly different. Personal development is predominantly done to gain, I would say, skills and abilities that you would need primarily for the purposes of maybe carrying out certain tasks and functions effectively. And this would be a self-improvement process. But when we look at talking about professional development, it is more going to be related to you having to develop skills which are required at your place of work in order for you to be able to effectively work and execute your roles and responsibilities. So this particular unit, when we talk about personal and professional development in health and social care in particular, is very important because we are looking at some stage, developing the skills which are required and having the knowledge which is required to be an effective person delivering these services to patients and clients within this particular sector. So an important unit, some part of this unit, we are going to be looking at studying from a point of view of, let's say, a couple of learning outcomes, and these learning outcomes are essentially dividing the unit into, if you see, 4 parts. So today's session is going to be looking at essentially getting into the first learning outcome to understand what could be the career and progression opportunities in health and social care. So broadly, we want to understand, what are the various roles or career options available for those of us who are undertaking and studying this particular course, health and social care in general, have within this particular sector. So we'll be looking at understanding our role, the knowledge and skills that we require to become a professional healthcare worker, healthcare assistant, healthcare, take up a healthcare role, and different kinds of healthcare role which can be taken. And we'll study about these roles and some of the opportunities that you can get if you start within this sector as a very basic, at the very entry level. How do you then progress on to other, options? When I say other options, what I mean by that, how do you progress in your career to senior positions within this particular sector, and what kind of opportunities are available? And then towards the end, in the third learning criteria of learning outcome 1, we are going to be looking at analyzing our knowledge and skills required for a specific role. For example, if I want to work as a nurse, I want to work as a practice manager, I want to work as an occupational therapist, I want to work as a GP, what kind of skills or specific knowledge or qualifications would you require to be able to work within this role? So a very, very interesting unit, which will give us a lot of knowledge and insight into why do we want to work within this sector and what kind of roles, opportunities, career opportunities are available to us in general when we talk about, the health and social care sector. So let me switch over to a presentation. And in this presentation, the main aim of the unit is to help you develop skills and knowledge required to plan so that you can successfully find a job within the health and social care sector. And then not just find a job, but also find a job which will help you build a career within this sector with your, choice in terms of your liking. For sometimes when you look at finding a job, you try and find a job wherein you like the job, you like the organization, you like the role that you play, the people that you work with. So it's all about finding, all about learning about this, going about learning in this unit to find about, what kind of roles are available if I want to make a career in this sector, and what kind of roles, if I do take up, can help me progress and build a long-term career option within this sector in terms of senior roles, more pay, better title and things like that. There's a fair bit of content that we need to look at covering in this unit, which basically includes things like career options in health and social care. What are the various types? We look at all these roles. We look at what are the roles and responsibilities briefly in terms of looking at various roles, because there are lots of different types of roles possible when you look at health and social care, career within this sector. So when we talk about various job roles, we look at, I think from the best of my knowledge right now, there are 4 or 5 broad categories. And these 4 or 5 broad categories, each of them has, at least, if not less, maybe 7 to 10 different types of roles that we can see and work within this particular sector. So we look at the range of options which we can essentially see and go into in a bit more detail. Now, the other bit that we will also look at is find out what are the skills required. Now, I don't want to, put it this way that, yes, I want to be a doctor, but I need to have certain kind of skills or knowledge, academic knowledge, to be able to work in that particular role. So if I want to become a GP, I could look at taking the route of GCSEs, but within GCSEs and my A levels, I need to have physics, chemistry, botany, biology, maths as the main key subjects. Then with the basis of these subjects, I can get into a uni, I can get into a medicine degree, do that 3-year degree with a 2-year specialization, and then become a GP. And then that degree will then give me adequate knowledge and skills to be able to work as a general practitioner or as a doctor. And that would allow me to then pursue a career in medicine within this sector. If I want to become a nurse, what are the various specifications I need to have? If I want to become a healthcare professional, what are the various qualifications I need to have? If I want to become a rehabilitation worker, a social care worker, or, an activity worker, somebody who's a therapist, we look at some of these in a bit more detail. Now, in the key terminology I spoke about, we need to know the key words which are required for us to study this particular unit. And the key words or terminologies are basically what is personal development and what is professional development. And sometimes professional development is also termed as what is called CPD, career professional development. Now, personal development, as I mentioned to you, is about you looking into taking up activities which are going to help you develop skills and qualities and abilities that are going to help you achieve your aims and objectives in life. Now, this tends to be because you maintain, you review, and you monitor your own progress, and it is because related to yourself. That is why it will be termed as, which is called personal development. Now, a personal development plan would be a plan that you create with a timeline and a series of or a set of activities. And if you stick to that plan, carry out those activities, complete them, then towards the end of it, you would see that you've gained either those skills, or when we talk about, when I say skills, anybody do you understand what I mean by skills? So skills are basically abilities which you can use to do things. And when I mean by skills, when I say skill, I can also say, when I talk about skills, is that my skill is I'm a good negotiator. Sometimes you say that I have a skill which basically helps me build a team. I can build a relationship. These are things that you are using as either your knowledge, your experience, or your skills that you've gained from studying, taking a course, which is then allowing you to complete that task or that activity. So when we talk about skills, there can be 3-4 different types of skills. It could be functional skills, management skills, knowledge-related skills. So functional skills are skills that you're born with, that you are having the talent as something that you are able to develop with a little bit of supervision. So for example, if I'm able to look at things like playing a guitar, or for example, playing an instrument, this is a skill that you've gained over a point in time by taking tuitions, lessons, and then practice, and that has allowed you to gain the skill of playing a guitar. That is a skill which is a specialist skill, and that can be attained when you take certain type of course or coaching, and that allows you to do it. Now, functional skill could be, I'm a trained technician, I'm a trained nurse, I'm a radiographer, I can use the MRI machine to do a scan, I can use the X-ray machine. Now, these are functional skills that you have gained primarily because you've been given training, and because you do this as a function, you are responsible for that particular role, and you carry out these tasks. You work within a hospital, you are working as a radiographer, and essentially what you're looking at doing is using the machine to be able to do X-rays or exograms, or an X-ray chart, or basically X-rays essentially with patients, and that is something that you're being taught. And then there are self-management skills, things like time management, things like decision-making, ability to be able to judge And those are skills that you teach yourself over a point in time. Some of them could be birth related, some of them could be things that you inherit, and some of them could be developed through experience and learning. So there are lots of different ways that we can develop these skills, and they can be developed using personal development or professional development. As I mentioned to you earlier, professional development would be things which are led by your employer, your place of work. And in those cases, it could be a combination of experience, coaching, mentoring, you attending some sort of course or maybe trainings, and they are required for you to be able to perform effectively in your job role. And they would require you to work with different sets of people within different sets of teams, departments, to be able to then make use of those skills to deliver your role and responsibility that you're being given when you work in a workplace. And these skills, when they are essentially reviewed by your supervisor, your manager, as a part of your annual appraisals, and gap areas are identified, and then there are further activities or trainings and development which are put in place in order to ensure that you have skills which are required to perform your role effectively, maintain standards in the care, for example, standards for care in health and social care sector, understand the key legislation and compliance which is required, policies and procedures which are required to be followed. In those cases, that they will become what is called the career professional development skills. Now, there's another term that is important in this particular unit when we talk about the unit aim, and that is about reflective practice. So when we talk about reflective practice, what do we mean by that is reflective practice is the process of learning through experience. That means you're going to be looking at learning, from experience, and that learning from experience tends to be, predominantly related to the fact that you are going to, let's say, do things. And when you do things at some stage, what you're going to do is, with the ability to be able to do things, what you're going to do is at some stage then follow somebody, mentor somebody, watch somebody, and that would then allow you to essentially pick up, skills which are required for the purposes of, use in your place of work. So reflection tends to mean you're analyzing your own experiences to improve in the way you learn and how you work. And these could be skills which are valuable because sometimes when you look at working within organizations, you pick up a lot of experience, you gain a lot of confidence by doing certain things repetitively, and this helps you become more self-aware. And when you are a bit more self-aware, you then understand what are the key things required to be able to carry out a particular role. And in those cases, you become proactive, you know what is required of me, how do I go about doing this role, and you are kind of self-taught. And you're not looking at depending on others to be able to come in and guide you to say, this is how it needs to be done. And this particular process is called the reflective cycle. And this was initially, this is a theoretical model that we will look at, which is called the CLOBS experiential learning curve. And this particular, cycle of reflective practice tends to be a combination of that you become self-aware, you are aware of the description of your work, you can critically analyze how you're doing, and what you're doing right, what you're doing wrong. You're able to synthesize and, process that information and then evaluate how you've done in that role, and then self-teach yourself to again do that bit, but this time do it in a better way, which is meeting the criteria or probably, exceeding or meeting and exceeding the criteria which has been set. So this is generally a skill that you would develop over a point in time as you become a mature learner, as you become a mature worker. And in this case, what will happen is you'll be analyzing your own experiences to improve the way that you will carry out these tasks in the future. And that would be the process that we would normally suggest as or reflect as what is called reflection. And this process that you undertake to carry out the practices and the way you go about addressing a particular task in a better and improved way every time you do it because of your previous experience would be something known as what is called reflective practice. Now, with this background in mind, let's quickly get into some of the assessment criteria to look at what the learning outcome 1 is talking about. It talks about understanding career and progression opportunities in health and social care sector. Now, before I go into it in a bit more detail, what I want you to look at is, look at this slide and think of the roles that you can do, or the jobs that you can pick up within the health and social care sector. So when we work within this sector, health and social care, we talk about things like the National Health Service, a care home, a nursing home, an old age home, a retirement home in some cases, or we look at working within a high street shop like a clinic which operates here, and skin care treatment. You look at maybe clinics which basically do Botox and fillers. So anything to do with cosmetic surgery, or some of these places which essentially provide some sort of medical / healthcare services. Now, when we look at, say, for example, saunas and spas, obviously, and we look at going to a chiropractor, or we look at going through a physiotherapist, and we look at taking some of these services from there, they are all kind of roles associated within this sector, because you're essentially providing some sort of a health and social care service to an individual, within the aspect of, this role. So if I look at talking about a few roles, we look at care workers, personal assistants, in the gym, as a coach, as a somebody who's going and doing, taking up some gym sessions because they've had an accident, or they've had some sort of a disability, and they are looking at taking help, and a personal assistant then works with you primarily to be able to provide these sessions. You look at a social worker, you look at a community support worker, you look at people who work within surgeries or some sort of practices, supervisors and managers like practice managers. You look at occupational therapist. So when I talk about occupational therapist, occupational therapist is somebody who is going to be, somebody who works with people who are either injured, ill, disabled. In some cases, they need to be going back onto their own feet in terms of recovery. If you've had an accident, for example, and you've had a bit of a disability, you would need an occupational therapist to help you develop, recover, improve, and, in some cases, even go and do your daily course till the time you become independent and do it. You have activities coordinator, you have technicians which work within hospitals, or, within the A&E service, for example. You have people who work within the administration, front-end office, and, any sort of ancillary or support staff, which primarily is associated and working within this sector, would be also dinner ladies, for example. If you look at hospitals, you have, the laundry service. You look at drivers, which basically work with blood banks and, organ donation, and they transport this. They're all working within the health and social care sector, and they are all roles associated with it. Now, with this background in mind, let's categorize some of these roles into various different types. Now, there could be roles that I would say which we have listed out. Some of these roles could be direct care roles. Some of these roles could be management roles. Some of these roles could be support roles in health and social care. And some of these roles could be maintaining legislation compliance. And they could be people who have who are required to have certain sort of academic qualification, and they would essentially be looking at regulated roles. That means they're responsible for some sort of compliance, making sure policies and procedures are adhered to, and obviously are responsible for standards of care. So they will be people who are in the regulated professional role. And then we talk about ancillary roles. The term ancillary meaning the roles which people carry out, which directly or indirectly revolve or work in tandem with this particular sector. And these roles, as I mentioned to you, could be cook, drivers, housekeepers, people who are involved in maintenance, technicians, and things like that. So if somebody is to ask you a question, what kind of career you would want to do, or what kind of role you would want to undertake in health and social care, then you clearly know that there are 5 different categories of roles that can be taken. And what I've done in the subsequent slides is basically listed out some of these roles. So let's look at very briefly some of the roles. If I look at direct care roles, These are roles which people would be carrying out because they are involved primarily in providing direct care and support to individuals. So these people could be activity workers, they could be care workers, they could be personal assistants, they could be rehabilitation worker. People sometimes, if they go astray and fall into, substance misuse or drugs, alcoholism, or if they need to repatriate and go back into the society, you will probably have people, who will be working with them as rehabilitation workers and helping them to get back to their feet, get back to the normal life, way of life. Advocacy workers, these are people who are going to be directly providing care. Somebody who goes into your home, stays with, say, an old age couple or a person and helps in the daily course because they are unable to do it themselves. In those cases, they will be direct care roles and they would be working as a care worker or somebody who's working at home to be able to provide care and basic needs to the individual. Then we look at management roles. These are roles which are going to be team leader roles, people who are in the management position. It could be related to somebody who's the head of the surgery, practice manager, somebody who's related to the hospital, and they could be, say, the head of the hospital, the clinical director. They would be what are called specialist or management roles. Now, these roles essentially are going to require you to be looking at effectively managing some part of your responsibilities. That means you manage a team, you supervise a team, you take care of decision making, you're responsible for essentially ensuring standards are met and compliances are met. So CQC, which is one of the most important body within this sector, the Quality Care Commission, you are looking at basically ensuring that the CQC guidelines are met and implemented within the organization. Then we look at other support roles, which could be roles that you are looking at, in terms of your interest, but you are not directly working with and providing care, but you're providing and part and parcel of roles that you will take up, which are going to be ensuring that some of these, care roles within the health and social care sector are, responsibilities which nurses, doctors, GPs, occupational therapists, physiotherapists, A&E carry out. They are going to be roles which other support roles are going to be support roles which will support the main team which is going to be providing care to the patients. So things like an housing support officer. If you are in welfare housing and, you need support in terms of tenancy, you live independently, things like that would be covered under that. Volunteering, when I look at, sometimes people volunteer to, work with charities and
Sorry to interrupt you, sir. Sorry to interrupt you, sir.
Yes.
I need to ask you one question. What is about CQC? You just mentioned about CQC. So which roles involved in CQC?
CQC is basically, one of the important bodies, which is called the Care Quality Commission. This particular body essentially sets, the standards which are required to be adhered to when we talk about the standards of care, which are provided, through any of the organizational setups like care homes, hospitals, dental health services, clinics, GP surgeries, people when they receive mental health care services or services within the community. So it's a government regulatory body which basically sets the standards which are followed within the health and social care setup to be able to deliver these services to members of public in the UK. So it's an important body, which is a compliance-related body. It's a regulator. They have the authority to be able to come in and inspect hospitals, surgeries, dental surgeries, clinics, things like that. And once the inspection happens, they look at verification of standards which have been set. And if the compliance is not met, the standards are not followed, then in those cases, what can happen is that they can even shut you down or put sanctions, withdraw funding, which is government funding, if it is being given to any of these, outlets or departments, or restrict and ask you to put a corrective action plan in place. So it's a very important body in terms of regulatory aspect of the health and social care department and sector within the UK. Does it answer your question?
Thank you, sir.
Okay. Now, when we look at regulated roles tend to be roles which are primarily going to be associated with, aspects of um, people who have to practice and lead the practice in this area. That means, for example, a nurse, for example, a registered manager of a care home, somebody who's a clinical director at the hospital, somebody who is responsible for, let's say, is the head of nurses within a particular hospital. They could be people who are requiring specialist knowledge and use of that knowledge to be able to deliver those services in that particular role would be people who work within the regulated professional roles under this particular sector. So we look at people who are, say, social workers, they need to have health and social care qualification. When we look at occupational therapists, they have some sort of qualification in their field. When we look at nurses, they have a nursing degree or a nursing diploma. When we look at counselors, they have some sort of a counseling, qualification. Just as an example, if I say that you are an authorized mortgage provider, or as somebody who's able to give advice on, mortgages, then in this case, you would need a particular qualification, and that qualification would be a certificate, from a regulatory body. And if you have that qualification and a certificate, then you're required to follow that, and have that qualification before you become, a qualified mortgage provider. So when we look at somebody like a nurse, if they are acting as a nurse, they are registered with the, the general medical, say, for example, midwifery and nursing, council, GMC. If you're a doctor, if you're a GP, you're registered with the General Medical Association, and these bodies would then give you the, permission and the license to be able to, essentially work within the sector. So they are people which are required, to have a necessary qualification to be able to offer their services, and they would follow within the regulated roles. Then we look at ancillary roles. Any sort of support role or any other role that we have not been able to cover under any other category would fall under ancillary roles. And these people are indirectly involved in running or helping in the running of the organization or some of the functions within the organization. So these people could be cooks or kitchen assistants, dinner ladies. When you work within childcare nurseries, you work as a dinner lady, you work as a childcare assistant, you work as somebody who is a childcare worker. These are going to be roles which are predominantly going to be termed as ancillary roles. So in the first assessment criteria, what we need to do is understand what are the careers and what kind of the various job responsibilities that you could have if you pick up a particular type of role within this sector. So any questions on this so far? Great. So let's go into the second assessment criteria, which is talking about explain progression within a chosen, healthcare field and within a particular area. Now, when we've looked at these 5 broad kind of roles, what we want to be able to do is, assuming I start my career as a healthcare worker within this sector, I'm age 21, 22, whatever it is, after my completing of schooling and my 6th form, and I complete a degree or get a degree, and then I start a particular role in this, start a job, within the National Health Service. What kind of progression opportunities can I get when I look at, progressing further after putting in a number of years of experience within this sector? Now, I have looked at a few because there are a variety of roles within this sector, and they can be classified. If I go on to the NHS website, and if I talk about, NHS or roles, or, healthcare roles, healthcare careers in particular, if I just quickly switch you over to a website and show you the kind of roles that you can actually look at within the health and social care sector. Now, if I do a quick search right now and I put this on, which is NHS careers, you land on to this particular website, which is healthcareers.nhs.uk. Now, within this, there are so many different types of roles that you can find within the NHS. Now, there are so many different types of roles, and that's why what they do is there are 350 different types. So what they ask you to do is to recognize what you love, what you like, where you would want to work, and what are your skills and competencies. They will ask you to take a quick, test, a small multiple choice question test, which will then suggest a role to you basis your liking and your skills and your qualities and your background. And as you can see, there are 350 different types. It will choose criterias like your qualification, your previous experience, your working, and in terms of your personality, your traits, your background. And then is when it will suggest you a particular career that you can choose within health and social care. So this is a very good website, and I'm going to put this link onto the presentation. My suggestion would be, after you have gone in and done attended this presentation and done this particular lecture with me, there is a task that I put onto the PowerPoint slide, and this is a homework that you need to do. By clicking on this particular link, it will take you to the website that I've shown you, and then by completing that particular survey, you would need to take a screenshot at the end of it and explain, send it on email to say, this is the survey I took, and then you send a screenshot of it to learnerwork@ukversity.co.uk, and that would help me identify, or it give you an idea and identify what kind of a role that you could do or progress into when you join the health and social care sector. So I'm going to discuss very briefly 4 or 5 different broad roles which you can look at when you start your career or take up a job within the sector. One of the roles is going to be of registered manager. Now, this registered manager typically requires you to have experience, qualification, and something that you need to have in terms of academic qualification at level 4 and level 5, which is a diploma at least, to be able to work within a particular setup. Now, the registered manager is primarily a manager which is responsible for maintaining compliances, making sure that services standards as directed or provided by the CQC are followed within the organizational setup. These standards and policies and procedures are then used to maintain the services being delivered and ensure that an integrated service plan is delivered, and in this case, the patient gets the experience which is requiring to get better or to get well soon, to get back on their feet, essentially by following these processes and procedures which have been laid down. So a registered manager's role is primarily to ensure compliance and compliance related to regulation which has been set by the body like CQC, some of the other regulatory bodies like NICE or the King's Foundation, the Health Foundation, the King's Fund, and some of the other regulatory bodies like the MIHR and things like that, to ensure that none of the procedures, processes which are compromising are being implemented, compromise on safety and service being provided to the patients in the setup. Now, you can work as a health and social care worker. Health and social care worker would require you to have a diploma in health and social care. This could be taking a variety of roles that we've discussed, in the roles that we discussed for health and social care worker. And these could be roles that you would either take up as support roles or could be direct roles under care. They could be things like activity worker, organizing activity for people who need care, support, including, say, for example, trips, helping them do their daily course. You could work as a care worker, as a personal assistant, as a rehabilitation worker, or work in other support roles which are going to be related to even volunteering and, somebody who's primarily responsible for ensuring, support when you're in, you say, for example, you are on benefits or you're using, you're dwelling in, council housing, things like that. Now, there are going to be some management roles, and these management roles are going to be related to, somebody who's a practice manager in a GP surgery, somebody who's a operations manager or a front desk manager in a hospital in an A&E department, and their role is primarily to be dealing with customers or patients in this case, and they are going to be responsible for ensuring all processes, procedures are in place to be able to run the place as an effective operation, as an effective unit. And they would require qualifications and skills at level 2, level 3, and they would generally be, various types of qualifications depending on the setup that you're working in. So if you work within childcare, you might need to have a level 3 diploma in or level 2 certificate in childcare. If you work within, say, for example, a nursery and you're a care worker, you might need to have a diploma in early years of childcare, which is EYE. You work within a particular setup related to an hospital or a community center providing, occupational services to patients who are receiving therapy, then you would be having a health and social care diploma. So they would be people essentially looking into, providing services which are related to, and being, as you gain experience, as you have more qualifications, you would go into and take up senior roles within the administration operation side of things, and they would be, team leader, supervisor roles. Then we look at regulated professionals. One such regulated professional that I've taken an example of is, which is a nurse, a trained nurse. So you are a member of the Nursing and Midwifery Council, NMC as we call it. You have a degree in nursing, you are a qualified nurse, you could be a mental health care nurse, you could be an adult nurse, you could be a child care nurse, you could be somebody who's dealing with vulnerable adults, and you are also helping and carrying out nursing functions in a specialist area. And they would be, because you have an associated degree in nursing, and that would allow you to work or progress to a nurse in the health and social care sector. And then one of the other things that I've talked about in the support roles or in the regulated roles is the role of an occupational therapist. So here you would be working as an individual who supports people with physical, mental, social disabilities, and you help them in their day-to-day activities. And this is where it also requires you to have a professional qualification. It could be a level 4 or a level 5 diploma or a level 3 diploma, depending on at what level you work within the organization. You might be registered with the Healthcare Professional Council, HCPC, and have a membership. And that would mean that you are qualified as an individual to be able to deliver services which are related to physical rehabilitation or use of any type of equipment which people need to do in their daily lives because of the fact that they need to look at, carrying out certain functions. And this bit would basically summarize what could be, if you choose a career in health and social care, what could be that career job that you pick up, and that job over a point in time can help you build a career, and you can progress on to senior roles depending on if you're racking up experience and also doing academic qualifications, taking up trainings, and they can allow you to pick up any sort of further future roles which could help you progress into and progress into in this particular sector within your job roles. Now, as a homework, what I would suggest is do a bit of research on career progression, but definitely go on to this particular site. And what I would say is email then a snapshot or a screenshot, of the role which comes recommended, to you when you take the particular quiz or that particular survey on the NHS website, which I've put it, and then email it or to us across at learnerwork@ukversity.co.uk. Any questions on this so far? Okay, now let's look at the third assessment criteria, which basically talks about analyzing your skills and knowledge required for a specific role. Now, once you have actually done and taken this quiz and you have come out with a particular role, because there are, as I mentioned, 350 different types of career options or, roles which you can actually take up in the health and social care sector. So when I talk about, health and social care sector, you can look at 350 different types of jobs. Now, when you come up with the option of taking when it suggests you this is the right kind of job for you by taking this particular survey on the NHS website. Here in the next task, what you have to do is you have to look at what could be the specific skills and knowledge that you require to work within that particular role. So in general, if I talk about, what are the personal skills which a healthcare professional needs, or HCP as we call it in short. So if you hear the term healthcare professional or HCP, then that tends to be, a synonym for healthcare professional. Now, in general, when we look at people working within this sector, they need to look at having these particular, skills and abilities to work as a HCP within this sector. So things like skills that you need is empathy. That means you need to be able to empathize and sympathize with people in their difficult situations. You need to be flexible to your work, because in this particular work, you have working in shift patterns. So sometimes you would see nurses, doctors, healthcare workers, support workers working within different shifts, because this is a 24/7 job. So you work in shifts. So you should be flexible to, work when you're looking at taking up a career in this field. You should be a team player. Now, here, most of the jobs that we do or the roles that we perform are a part and parcel of a team. You are going to be a part of a nursing team, a doctor's team, a medics team, housekeeping team, or for example, a night team or a day team. And you are going to be performing certain parts of your jobs, which will then lead to other people taking up that from where you finish. They will start their job and then carry out that function to provide services to the patient. So you have to be a very good team player. You should be able to work within teams, be able to delegate work, take over responsibilities, give responsibilities, depend on others, and be open to taking suggestions and working with colleagues if you have to work within this sector. You should be able to deal with pressure. Sometimes this job involves dealing with multiple things, and obviously sometimes you're working late hours. A doctor can't say that I've spent 4 hours in the operation theater, I'm tired, now I'm going home. No, it involves you doing your job, doing it diligently, doing it meticulously, making sure that the outcomes are achieved. And because if things are not performed to specification or not performed to the right standards, it can lead to loss of life. So here, sometimes people have to work with dealing and understanding that the work involves dealing and working with pressure, under pressure. You have to have excellent communication skills. Now, these are basic abilities which sometimes, healthcare workers or people working within this sector need to have. And that is what I've listed down here in terms of, key responsibilities, or at least skills that you would need to have to be able to work as somebody who's working within this sector, or taking up a particular role within the health and social care, sector as a career. So you should have strong work ethics. You should have a positive mental attitude. You should be able to manage time. You should have self-confidence. You should be able to deal with criticism, because you can deal with all different types of, patients. Sometimes they are a bit edgy or nervy. And in those cases, you have to keep your calm, you have to keep your cool, and you still have to carry on with the task. You can't obviously shun your work or go away and say, I can't do this. No, it's unlike any other profession wherein you can choose to refuse to serve the worker or serve the patient or client, serve the client essentially or customer. But in this particular role, you do not have that option. So essentially, you should be thick-skinned. You should be I'll put it this way, that you should be thick-skinned. You should be able to take criticism, and you should be able to have a positive, mental attitude. You should be self-motivated. And these are basic aspects of how you would be looking at, having the skills to be able to work within this sector. Now, one of the key things that we look at in terms of how do we improve knowledge, how do we look at, when we talk about skills and when we talk about knowledge, what is knowledge essentially? When we talk about knowledge is something which is that we know, which is a fact, which is information, or a skill that we have acquired over a point in time through our working and experience. It could be through something that you have studied, had a training or education. And this theoretical or practical understanding of the subject which allows you to put your abilities to work and then get some tasks done, would be termed as knowledge. Now, one of the things that we need to have in this sector when we talk about and differentiate between what is skill and what is knowledge. So the difference is that knowledge is fact, information, skills that you have acquired through experience, through studies, through doing a particular course, and maybe years of experience. And that when you put to work, put to use at your place of work, would be termed as knowledge. Now, there are lots of skills that you need to develop essentially, but one of the key areas in which personal development within the sector is always focused on is these skills which are listed on the slide that are required, to successfully work within this sector, maybe as a health and social care worker in any type of role that you want to take up. And they would involve skills which are including skills on active listening. That means you should be able to listen to patients, capture key points, note down key points when you're listening, ask the right questions to be able to get the correct amount of information from the patient, which then can be used for decision making or prescribing medicine or prescribing some sort of a treatment. Second is conflict management. I'm not going to go into detail, but just broadly speaking, there are lots of different types of conflicts which a nurse can face. For example, a dilemma can be faced by the doctor that, okay, if you're doing an operation and if it's critical, and is it important to save the life of the mother or the life of the baby? Sometimes these are conflicts that, are difficult situations which people can face within this sector. And in this context, what needs to happen is that you should be able to manage conflicts or crisis management, essentially. And these are skills which are going to be required for people working within regulatory roles. You're always dealing with challenging behavior. One such example of challenging behavior could be patients being rash with you, rude at you, showing an attitude, not consenting with you in terms of cooperating. And in those cases, you are given trainings to be able to understand how to deal with patients when they are challenging in certain situations. And then you work with people to understand, sometimes you're working with individuals because they have disabilities. So in those cases, how do you look at making sure that you're dealing with them in a dignified manner, you're giving them freedom, you're giving them space, you're giving them the independence to be able to make decisions, you're respecting their privacy and their dignity. And those are bits that are required, any organization within this setup or within this sector then helps to basically, develop. And that some of these are developed through training, which your employer will recommend. Some of these skills you get from taking up education and experience, and some of these skills you develop as knowledge over a point in time because you have worked within this sector for a number of years, and the experience allows you to gain that knowledge and then put them into practice. So here is where you would need to look at analyzing the skills and knowledge required in a specific role. I have written them down generically, but depending on the outcome of your survey that you receive from this particular quiz that you take on from the website, then the idea would be that you go about, if it comes up that you are suitable to work as a healthcare worker, if it comes up you're suitable to work as a nurse, if it comes up that you are okay to work, with a role of a support worker, then the idea would be to identify by taking this particular survey, which I'm showing you on the website. The link is on the presentation. What you would then do is go about listing down the skills which are required for you to work effectively within this particular role. That comes out as an option for you when you undertake this survey for 5 to 10 minutes. So this is what we have to cover in today's discussion, which is on the first learning outcome in this unit, and that helps us wrap up things for today's discussion nicely. So any questions on this so far, what we've discussed? Any questions, anybody at this stage on what we've discussed so far? Right, so if there are no questions, then what I will do is I will catch up with you tomorrow I think we are going to now do these sessions on Tuesdays and Wednesdays. So tomorrow, 11 a.m., I will catch up with you to discuss the second learning outcome. And then if you, in the meanwhile, think of any questions or if you have any queries, feel free to write to me at learnerwork@UKversity or litc@UKversity, and I will come back to you with more details. So thank you so much for joining. And if you need to get a copy of this particular recording, then you can visit our YouTube channel, on which the copy of the recording would be there, and the copy of this presentation would be available primarily from your Moodle logins. So this is where this particular session is going live, as you can see. So when I click on this, it will have a bit of an echo. And you would be able to get all the sessions once they have been, if you need to revisit, then you need to go into the live section. And in the live section underneath that, you'll be able to see some of the sessions that we are conducting and recordings. If you need to revisit, they will be available from there. And if you go into the Moodle, you'll be able to see the recording, the presentation, and any other associated handout that I'm going to load will be available primarily for the purposes of recapping on what we've discussed during the session today. So this will come up in this particular unit, which is personal and professional development towards the end, for those of you who are doing this particular course. So I'm going to enable this topic, and obviously the copy of the presentation would be available shortly from this particular setting. So thank you so much for joining, and I will catch up with you tomorrow in this next session to discuss the next learning outcome. Thank you.
Very.
Thank you.
Thank you. Bye.
Bye.